Hey! Somebody point me to the abrasion!
I'll take a look.
I love the intensity of the white cells. They're like, just where are they? Get some. Hey everybody, and welcome back. Excited to jump into episode 2 of Cells at Work. I am Dr. Todd, by the way.
I'm Allycia.
I had a blast with episode 1. I don't know if you
did.
tell.
Geeked out a little bit.
This was really good. Such a clever show, and I'm excited to keep going. We hope you guys are excited to keep going with us. So getting ready to jump into this one, Cells at Work, episode 2, Scrape Wound. Before we do, consider subscribing, help us grow. We've had such an amazing time doing this.
This was my first anime show ever.
Yeah, first ever. I was at the office today thinking about this show. Well, I was like, what's going to be in episode 2? Like, what are we going to talk about? What are you going to learn about today? All right, so let's
go. I hope we get to see more of the little platelets.
It's called Scrape Wound, so we will definitely see platelets.
Oh, okay.
Yeah.
All right.
What do you think happens when you get a scrape?
It scabs.
Yeah, but how?
Inside every human body, there are roughly 37.2 trillion cells.
I don't know if I knew that, like the actual number.
Yeah.
And they all take their jobs very seriously.
Oh, look at the cute platelets.
I know, they are cute.
All right, let's see here.
Bringing nutrients.
Mm-hmm.
I'm guessing you need some help.
Oh, Senpai, what are you doing out this way?
Maybe that's so you can differentiate them, the numbers.
Maybe.
I'm heading that way myself. You want to just tag along with me?
Yes, please.
You're right. We're going to see lots of the platelets.
Tiny but mighty.
Is that what they call platelets?
I don't know.
These are platelets.
Like-
They're a type of fragmentary blood component. They aggregate wherever a blood vessel is damaged in order to clot and cover the wound.
That is true.
Everyone, be super careful.
I wonder what she's carrying.
I don't know. Maybe like trackers or something.
Oh.
Because they do signal like for backup, basically.
Okay.
What happens if they fall?
I don't know. Did they get a scrape knee?
But the true power of platelets is their ability to aggregate. And so I think the fact that they're in these like clumps is intentional.
Yeah.
How lovely. Things have been so peaceful in this blood vessel.
Was that maybe like saying something bad's gonna happen?
Yeah. Like saying it's quiet.
Won't let them get away, I'll chase them. We are professionals, we're cells at work for you and so.
I do hope we see some more of those, like, I assume it was a neutrophil maybe? The white cell.
Did you see the white one had a platelet on its back?
Yeah.
You're very welcome. Hey everybody, this looks like the perfect place to wash the fibrin. Yay!
Fibrin.
Fibrous tissue?
So fibrin is what helps, kind of helps hold everything together. Becomes like glue, I guess.
Okay.
You gotta make sure you get all these routes down pat. That's the first step to doing this job. You got that?
Yes, ma'am.
So I think I mentioned in the first episode, but a red blood cell lives about 120 days.
Yeah.
So highlighting a mature red blood cell and then a new red blood cell.
This part of the blood vessel is really close to the skin. Even the slightest bit of trauma can have a huge... Whoa! What in the world just happened? Sometimes things can get...
What in the world was that? Hey, look over there!
Uh-oh.
This isn't good.
Uh-oh.
So is that like a wound?
I assume, yeah. Skin wound. Skin abrasion.
Why am I floating?
Oh, because they're losing blood.
Yep. Oh no.
Oh, look who saves her.
Didn't think I'd run into you down here.
And white cells do need to be here because there's now an opening for germs to come in.
There was external trauma to the blood vessel. A part of the outer wall has been destroyed, so blood cells are falling off the face of the world.
I don't think I'll ever look at my blood the same. Like, get back in there.
An injury formed when the skin is scraped, resulting in a wound no deeper than the epidermis.
It looks pretty deep. But they're right. An abrasion is usually a pretty superficial wound.
Yeah.
You mean like permanent and forever? Then why are we just sitting here? We've got to hurry and do something!
That's where the platelets come in.
The wound itself will get taken care of in time. Right now, we've got another problem to worry about.
Infection.
Yeah.
Get down!
So that's what I was saying. Now you are vulnerable.
Yeah.
Because there's a pathway in now.
So this is what it's like inside a human body.
Oh my god, look at all of them.
I could get to like it here. Staphylococcus aureus, a highly toxic antigen that
Yeah.
commonly resides in the skin and pores.
That's a nasty bug.
Among them are skin infections, food poisoning, pneumonia, meningitis, and more.
Especially if it's methicillin resistant.
Which is an antibiotic, I assume.
You guys get out of here.
Right!
Time to get to work.
Don't worry, I can handle this. Just get out of here.
You see what that jerk did? Let's drag him out here and make him pay!
Why's the blood vessel constricting?
I don't know, something big must have happened. Vasoconstriction.
Reduces blood flow.
It attempts to slow the bleeding by constricting.
A gigantic army of bacteria is pouring into
Whoa, what?
They need more of those white blood cells down there
I
to help
know.
out.
I feel like this guy's doing all the work.
I know.
You okay?
Yeah, I'm okay, thanks.
Come on.
'Cause I assume he's a neutrophil.
Well, who's the... Oh, that's what you assume that is?
Yeah.
Looks like your world now belongs to us.
Streptococcus pyogenes.
Group A strep causes strep throat.
This reminds me a little bit. Isn't this kind of how Pokemon is? Like when a new... I guess that's anime, but I've never really watched it.
Pseudomonas.
Now
One of
that's
the
a
most
nasty
common
bug.
types of bacteria
Pseudomonas.
existing in natural environments.
Our son had a Pseudomonas infection in his ear,
Oh, is that what? Yeah.
and it probably looked like that.
Mm-hmm. It probably looked like that. The
You
one
can
big
hand
guy
over the nutrients or die.
in green.
Well, it can cause green, like a green discharge.
Yeah, it can cause it some bloody discharge.
Weren't you listening? Any blood cells not delivering nutrients will die.
Huh?
Not today.
Where are those filthy germs?
They're gonna die!
Somebody point me to the abrasion!
I'll take a look.
I love the intensity of the
Yeah.
white cells. They're like, just where are they? Get some.
Got their work cut out for them.
Guess so. Those white blood cells seem to like their work a little too
Yep.
That's their job.
Take this!
Oh no.
Immobilize him! I'm on it! Easy peasy. Just try to move. Now die! Ow!
Killed him with his own tentacle.
Yep.
Now that's odd. Why choose to fight me here? It doesn't make any sense.
Diversion.
Number 2048 for the dire situation nearby. Head over and back him up.
We'll join the two of you as soon as we neutralize these germs.
I wonder if white blood cells have unique codes. That's how they communicate.
They do communicate. Yeah.
Yeah, but that's what the codes, that's what they're calling out to each other.
I mean, they use like what's called cytokines or these interleukins. These are different like communication. I don't know, molecules.
How can there be so many of them? Thank you. You saved me. No, you held your own.
Oh, there's one just floating in the sky over there.
Well, that's the baddest one.
Oh.
Staph aureus.
I've got some friends who want to say hello.
Make way for the cavalry!
Help is on the way.
989, no!
Oh no.
4989.
I mean, you must be getting tired by now. When you stop to think about it, you neutrophils are pretty pathetic.
Neutrophils. Yeah.
Yeah.
If I heard you right, you called us neutrophils, not just white blood cells. Good to know you came prepared.
Are you joking? Of course I have. Especially after I heard a certain pneumococcus perished because he failed to case the joint.
She talking about your brother.
Studied up on every last member of the immune system. For instance, I know that you neutrophil brutes are always first on the scene.
Mm-hmm.
And I know that the big guns, the macrophages and monocytes, tend to arrive fashionably late. Basically, all I have to do is take out you neutrophils right here and now.
I don't think it's gonna be that easy.
Well, at some point they need the help of antibiotics, right? That's if the infection takes over.
Yeah, I mean, if the infection overwhelms your initial immune ability to fight it off.
Yeah.
I see your plan now. It's pretty stupid.
Excuse me?
All your planning, and you forgot the one cell you needed to worry about.
Me. No, I don't know.
I'm talking about the strongest cell. True professionals who can turn the tide in mere seconds.
Thanks for all of your hard work.
Oh, the platelet?
Oh, okay.
Huh?
So remember to stay together, so make sure you use your GP1B so you don't fall out of the wound.
GP1B.
Either coagulation factors? Yes, we did! Alright then. Platelet
So-
squad?
Probably factor 8.
Cover those platelets at all costs!
Thank you all so much!
So I assume when the wound gets closed, then it's harder for bacteria to get in.
I mean, then you've taken away their port of entry.
Yeah.
Now attach the fibrin to the coagulation factors, like this. Yeehaw!
Miss Staphylococcus, we have a problem.
Blood clotting. Once activated by a binding protein referred to as the von Willebrand factor,
Von Willebrand factor.
Yeah.
We will talk about that. That's a very interesting thing.
proteins in the blood called coagulation factors are activated. This ultimately forms a fibrin mesh over the entire injury, thus completing the first stage of sealing a wound.
Call that the platelet plug.
Those little brats plugged up the wound? But that means I can't go for more backup!
Get ready to die, germ!
Like G.I. Joes.
Yeah, I know. Well, they're like soldiers, right?
Left you all by your lonesome.
You think I care? I'll defeat you all on my own!
That's how you describe it to our kids.
Yeah, it's an army.
Like an army.
Germ exterminator!
Softly laying on a bed of fibrin.
It's real good to see you made it, 4989.
Yeah, I guess I did.
4989.
But he's seen some things now. He's going to need some therapy.
I know. They have therapy for white blood cells. What repairs the white blood cells?
I don't know that you really can repair a damaged white blood cell.
You just make new ones.
Hey, red blood cell.
Oh, thank goodness. I'm so happy you made it.
Put them in the spleen.
Well, if you never want to see
Only
him
with a
again.
couple of scratches. Fitting for an abrasion. Just ignore it.
Everybody's safe and sound and looking to gather together. But I told them I wanted to come find you first.
Is that right?
Oh.
I just wanted to say thank you.
A nice breeze in her hair.
All you white blood cells risked your lives fighting those antigens for us. And then the platelets pulled their weight by closing up the wound. The only thing we red blood cells did was run away. We were useless.
Oh, you're not useless.
Not that there's much I can do, other than, say thanks.
Oh, is he crying?
No, that's not true at all. You're not useless. You saved us today. What I mean is you're saving us right now.
Hey, are you absolutely sure you're okay, white blood cell? You haven't moved once this whole time that I've been down here, and
Did he die?
Oh.
Whenever a hole opens up in a blood vessel, it takes a while for the outer wall cells to be restored. In the meantime, the bodies of blood cells like us get used to plug that hole. It's called secondary hemostasis.
Yeah, don't really care what it's called right now.
Yeah, it's basically like a true clot.
Okay.
in only a few short days, this clot will dry up and become a scab.
Oh, that was cute.
Yeah.
Oh,
okay.
next one's influenza.
Say less.
Oh, that's a good one.
Can't wait for that.
Especially during flu season
I
right
know.
now.
Yeah. Diagnosed like 4 people today. All right. So great episode. And it gives us a lot to talk about.
Yeah.
These cute characters make it hard to like, next time I bleed, I'm going to be like, no, that was 91218 something. Just doing their job, the neutrophils. So I guess, I think neutrophils only live like 10 hours or something like that. So they have a fairly short life.
Was he a neutrophil? He was a white blood cell.
He's a neutrophil.
So the white blood cells, they're not just white blood cells. There's neutrophils and other ones of white blood cells.
Oh, there's all kinds of white blood cells.
Oh.
And so when you look,
It's like different categories.
when you do like your blood, when you get a CBC done, complete blood count at your doctor's office, the WBCs constitute the white blood cell, but that is further differentiated. And so if you ever see a CBC with Diff, the differentiation then shows you like the breakdown of the different white blood cells. So you have your neutrophils, which are what he is, the first line of defense. Then you have like your monocytes, which differentiate into macrophages and dendritic cells. So these are also part of that kind of innate. We talked about those a little bit last episode, those antigen produced or presenting cells. You have your basophils, which are mostly, I guess, tied into like allergy. And then you have eosinophils, which are also commonly associated with allergy, but actually...
Those are the ones that have all the percents by them.
Yes. Yeah.
I really thought they meant nothing.
They mean everything. So your eosinophils are usually low, like they should be. Some of these cells should be quite low because if they're high, that could indicate that there's a problem going on. And so eosinophils actually used to be used in like parasitic, I shouldn't say used to. They're involved in parasitic defense, but thankfully we don't deal with a lot of parasites like here. There are certainly parts of the developing world that do. But so you could argue evolutionarily speaking, this is partly why allergies are so much more common today, and allergies are so much more common in the developed world because our immune system has sort of been repurposed a little bit.
Interesting.
And so they used to have to fight like parasites were a part of life. And so like helminths specifically, like those large like worms were what eosinophils would largely control.
And because they don't have anything to control, they just look for things?
I mean... I guess kinda.
Yeah.
Like they've changed. Its purposes have changed.
Mm-hmm.
And then you have lymphocytes, which are your B cells and your T cells. I know we mentioned some of this last episode, but so there's lots of different cells at work in your body.
Like how you did that.
But this episode was all about the platelets. So thrombocytes, as we call them, platelets are made from what's called megakaryocytes. What's interesting about that is liver disease. This is why, like, say, alcoholics often will have a low platelet count.
Mm-hmm.
And that may be one of the only things you see because they're not producing enough platelets. Okay, so thrombopoietin is what's produced mostly by the liver. And that causes, say, bone marrow to produce more platelets. And then erythropoietin is made in the kidneys. And so that's what tells the marrow to produce red blood cells. And so kidney disease can lead to anemia from low red blood cells because of that. And liver disease can lead to low platelets. And then bone marrow diseases can lead to all of it. We call that pancytopenia if all the cells are low.
Okay.
And so anyway, platelets will cause what's called primary hemostasis, which he referenced, secondary hemostasis. So primary hemostasis is when there's a breakdown in the cell or the lining of the red blood cell. So there's endothelial injury, and that causes there to be a breakdown which you could lose blood from. And then the platelets, their job is to aggregate, form what's called platelet plug, and then that kind of activates the next stage, a cascade of secondary hemostasis. And von Willebrand is interesting because that von Willebrand is sort of like the glue. Like it's sort of like the sticky substance.
That was that pink, like looking stuff. Yeah.
Yes, because it allows it. So because when a vessel is injured, collagen is exposed. And platelets they're not going to stick to that unless there is von Willebrand to allow them to stick to it. And so there's actually what's called von Willebrand disease, where you don't produce much or any von Willebrand. And so your platelets have a hard time plugging or have a hard time forming that platelet plug. And so then these people are more likely to bleed. And it's usually like your more minor bleeding, like nosebleeds, gum bleeding, maybe excessive periods in women. And sometimes people go their whole life without knowing that they have this. Now, von Willebrand disease, this is what's interesting. So platelets carry this von Willebrand, but they also carry factor VIII. Most of the clotting factors are produced in the liver. Factor VIII is actually carried with platelets. Factor VIII is also what's deficient in hemophilia. And so if you've heard of hemophilia, this was like a royal disease. If you remember, there was like the royal family of England back in the however many hundreds of years ago.
Okay, yeah.
Because of their incestual reproducing, hemophilia ran rampant in that family. Now, that's a clotting disorder. Those are more major bleeds. So you can bleed like into joints. You can bleed internally, and that's a bigger problem. And so we call that hemarthrosis if you bleed into a joint. So anyway, von Willebrand's disease is an interesting one for that reason. And that was all I was going to say about that. Make sense?
All the sense.
All the senses. All right. So yeah, that kind of brings it, I guess, back into real life though. Like that's a problem with platelet function. And so when we have somebody who has got a bleeding issue, maybe they're bruising easily, the first question I always ask myself is, okay, is this a problem of volume or is this a problem of function? And so if somebody has low platelets, they might bruise easily. And
Okay.
they may have a normal number of platelets, but still be bruising because the platelets aren't functioning normally. And so that's a platelet dysfunction issue. And so those are two different things you look at. And those are some of the things that go through our mind as we're evaluating them.
Was there something with platelets with pregnancy? Like when I delivered our first, I had low platelets.
Yeah, so you had developed like gestational thrombocytopenia, which thrombocytopenia is the term for low platelets. And so your platelets were being used up, probably honestly sequestered. And that's kind of a different thing. But yeah, your platelets were dropping. And this becomes a big deal, or can be a big deal, because, you know, if they have to do a C-section.
Which they did.
Which they did. Or if they're going to do an epidural, you know, they don't want you to excessively bleed. So normal is greater than 100,000. Between 50 and 100, though, you can still say do surgeries and things like that. Now, once you get below, say, 20,000, that gets a little bit more critical. And so this actually ties in well to the other show we've been watching, The Pit. So there was that case of ITP. So she had a very low platelet count, and that's why she was bruising. Her platelets were like 9,000. So less than 10,000 platelets, and people will spontaneously bleed. Like they will commonly spontaneously bleed, which is what happened with her. You actually transfuse platelets if it's less than 10,000 usually. Less than 20,000 but greater than 10, that's a gray zone. If there's other risk factors, like if someone's got an infection, you might go ahead and transfuse. If it's like a case of ITP, you may not necessarily. So you just kind of watch that closely. But anyway, another great episode, another chance to dive into some really cool science here.
Yeah.
I'm excited for the next one called Influenza, because I think one thing that I've been thinking about with this show that would be cool to talk about is kind of how vaccines work.
Yeah.
Like how what they do inside the body, and why some viruses can be, you know, quote, eradicated. You know, how like polio, for example, and why things like the flu are so difficult to control or contain. So I think that opens up a lot of really interesting discussion there.
Yes.
So stay tuned for that, because I can't wait to see what they do, and then we're going to talk about that. Thanks for being here. This was a lot of fun. I'm sorry for the long outro. I just get really excited about this stuff. You can imagine what my patients feel like when they're in the room with me. They're like, God, he won't just shut up.
Yeah, they're like, oh, you got a blood disorder. Let's talk about that.
Let's talk about that. All right. Thanks for being here, guys. Have a good night. See you next time.
See ya.
I am Dr. Todd.